to we're not ready to do Wants and Reads bill yet, or we are. Let's take up House or Senate Bill 377. This is Wants and Reads marijuana bill that we heard. Let's pull that one out. There are amendments that he mentioned yesterday, so we'll wait till those get around. Okay, we're ready for a motion on the bill, which would then need to be followed by a motion on the amendments. Do I hear a motion on Senate Bill 377?
Mr. Chairman, I move Senate Bill 377 do pass.
We have a do pass motion on Senate Bill 377. Is there a motion to amend?
I guess I'm nominated, Mr. Chairman. I move that Amendment SB 037701.ASO be posted in.
Okay, we have a motion to amend, and I'm just going to go straight to our legal counsel and ask for a rundown on the effect of the amendments.
Mr. Chairman, members of the committee, unfortunately, I did not prepare these amendments. They were prepared by the bill drafter, Sue O'Connell. So what I do know about them is that these are amendments that Senator Wanzenreed requested and that he is in agreement with them. In terms of the actual amendments themselves and what they do, I'm looking at them for the first time myself, so I don't know exactly. I do know they include 2 of the 4 amendments that were discussed by Pat Keim, who spoke before the committee regarding pre-release centers. But beyond that, I don't know. I'd be glad to get Ms. O'Connell to go through them for you if you'd like.
Let's do that. Let's just stand in recess for a couple, 3 minutes while we try to get Sue to come up and go through the amendments if we can find her.
Mr. Chairman, did we defer on the 24/7 bill for the day? I guess I missed that.
Let's come back to order and thank you, Sue, for coming up. And Sue O'Connell is the drafter of the bill and the proposed amendments. So if we have a committee to deal with here, we'll let Sue go ahead and give us a rundown on the amendments, if you would.
Thank you, Mr. Chairman, members of the committee. For the record, I'm Sue O'Connell, research analyst with the Legislative Services Division, and that's O''CONNELL. Mr. Chairman, members of the committee, I think perhaps the easiest way to do it is just go page by page. A lot of the changes are minor internal reference changes, so I won't discuss those. You'll see in the title that it strikes the fact that the bill would establish an advisory council, and that's because later on that whole section is removed and allows the department that option on its own. The department already has the ability under state law to create advisory councils, and so rather than making it a mandatory council, this amendment removes it and lets the department decide later on if they want one. And so that would probably reduce the fiscal note a bit, but not entirely. Amendment number 3 on page 1 inserts a new definition, correctional facility or program. That's reinserting language that's in the current law, and that comes into play later on when some other amendments come in and say that you can't use marijuana in a correctional facility or program. And that was important to some of the community corrections programs that they be included as well. And so essentially the amendments involving that, again, revert back to current law. Amendment number 5 on page 1 changes the health care providers who could provide written certification for a medical marijuana patient. Current law allows a physician to do that. The bill proposed to allow, in addition to a physician, a chiropractor, a psychologist, a naturopathic physician, and any advanced practice registered nurses who have prescriptive authority. This amendment would limit those individuals to just a physician or a physician assistant. Then there are a host of amendments on pages 2 and 3 that amend some of the prohibitions on where you can use medical marijuana. And essentially all of these amendments take the law back to its current status. The bill would have allowed smoking of marijuana in a lot of other places than are allowed under current law, and Senator Wanzenreed decided not to proceed with that change. So essentially we would be back at current law with those. And again, there is a prohibition in the current law on driving under the influence of marijuana. A law enforcement officer could stop you, get a search warrant, can test your blood, and you could be convicted even if you were a medical marijuana patient. Senate Bill 377 took that out of the law. These amendments would put it back in so that you could, again, be charged with a DUI and lose your medical marijuana card if convicted. And then some of the other amendments primarily clarify the amount of the fees and how often they would be collected. I believe those are the essential amendments. There were some changes to the inspection section as well. The bill proposed primarily to take out any law enforcement inspection of medical marijuana businesses. The amendments would put those inspections back in but require a search warrant before law enforcement could look at a business's records or inspect the premises. Mr. Chairman.
Thank you. And we'll ask you to stick around for questions if you would. I would just tell the committee that you remember Pat Keim testified against the bill for his client, and he told me that this morning that if we adopt these amendments, then their opposition is gone, that their concerns are taken care of, and they would no longer have a position of opposition. So with that, are there questions on the amendments that Sue can answer for Senator Fielder?
Thank you, Mr. Chairman. Yes, Ms. O'Connell, would you please, you mentioned on the first amendment item that it would reduce the fiscal note a bit, and my main concern with this bill is the fiscal note. So how much would we be looking at in a reduction on the fiscal note, roughly?
Mr. Chairman, Senator Fielder, I haven't looked at that specifically. I think it would be a very small amount because the advisory council was supposed to meet periodically. I think most of your fiscal note deals with licensing or registering a number of new types of businesses.
Okay, thank you.
Senator Wittich.
Mr. Chairman, question for Ms. O'Connell. Two questions. There were 4 bills in the House that addressed what Judge Reynolds did on his injunction, which would have loosened up some of Senate Bill 423, or relaxed, I should say, Senate Bill 423. And my understanding is all 4 of those bills were tabled in the House. When I look at 377, it looks like it's quite a massive expansion in the medical marijuana program from what we currently have. So my question is, go back 2 years ago before Senate Bill 423, we had a medical marijuana program in Montana, which Senate Bill 423 was trying to correct. If we pass 377, even with these amendments, how does it compare to pre-423 Montana's medical marijuana program? Does that make... are we actually expanding beyond what we had in 2011 when we passed 423?
Mr. Chairman, Senator Wittich, I think in some respects, yes. In some respects, you would be putting more of a structure around the medical marijuana, what was an industry at that time, so that there would be more registration of the businesses. It would be clear who was doing what and who was authorized to exchange marijuana among themselves. You would be expanding the amount of marijuana that both patients and people involved in the industry could have as well. So in that respect, it would be an expansion. Getting back to the 4 elements that the House bills tried to address, I think this bill also deals with all of those because it removes the limit on patients, which is under challenge right now in district court. It removes the ban on compensation. It removes the advertising ban. And it addresses the inspection issue that's being challenged in court by requiring a search warrant for law enforcement before they inspect. So I think all of those 4 issues are probably addressed in this bill. But in response to your other question, I think there would be an industry that is regulated under this bill, or at least registered and regulated in accordance with whatever rules the department adopts.
Senator Fielder.
Thank you, Mr. Chairman. I just also wanted to point out for the committee, it's my understanding that line 13, page 22 adds post-traumatic stress disorder to the conditions that could qualify for receiving medical marijuana card, and that was brought to us in a separate bill that we didn't pass, and I don't see that's not part of the amendments. That wasn't addressed in the amendments, but that was included in this bill as well as the other one that we didn't pass.
That wasn't a question, was it?
That was not a question. That was just executive discussion.
Senator Vincent.
Thank you, Mr. Chairman. And a question for Ms. O'Connell. And thank you for all the help that you've provided to everybody as we've been wrestling this issue for some time. It seems like last session was not that long ago. I wanted, and I know Senator Larsen also sat on the committee the subcommittee of this committee that worked on 423, and we had several different iterations of that, as you remember, in the many drafts we wrote. But what really turned, as far as I'm concerned, the corner that we had to turn was after we got that letter from the U.S. District Attorney, which was essentially sent to, I believe, Governor Gregoire at the time. And that's what, in essence, what the letter said was that the federal government would hold state employees individually liable for aiding and abetting in the commercialization of a Class 1 substance. So my question is, has there been any other developments on that front? And because that is the reason that we went, as you remember, we went to the more restrictive version of 423 was to try to protect state employees from that potential liability. So has that situation changed at all, Ms. O'Connell?
Mr. Chairman, Senator Vincent, I don't believe so. The federal government, other U.S. attorneys have issued similar letters. Sometimes they include the caveat that state employees may not be protected just because the state has a law. Not all of the letters say that, so I think it's still unclear for many states what action the federal government may take.
One follow-up, Mr. Chairman, Ms. O'Connell. So have they acted? Has anyone acted on a state employee in any state that is currently licensing or registering producers?
Mr. Chairman, Senator Vincent, I'm not aware of any action.
Okay, thank you.
Further questions for Sue O'Connell? Seeing none, thank you very much for coming up. Are we ready to vote on the amendment? I think we are. Pam, would you call the roll, please?
This is to amend Senate Bill 377 with Amendment 37701.ASO. Vice Chair Sales. Yes. Senator Brennan by proxy. Yes. Senator Fielder? Yes. Senator Vincent? Senator Boulanger? Yes. Senator Wittich? Yes. Senator Augare by proxy.
Yes, by proxy.
Senator Blewett? Yes. Senator Driscoll? Yes. Senator Jent?
Yes.
Senator Larsen?
Yes.
Chairman Murphy?
Yes.
Amendment passes unanimously.
The amendment is adopted. Now we need a motion on the bill as amended.
Mr. Chairman, I move due pass on SB 377 as amended.
We have a due pass on 377 as amended. Is there further discussion from committee members? Senator Vincent.
Mr. Chairman, members of the committee, and I think everybody knows kind of where I'm going based upon my previous question on this, and that I was for a different version, and I think members of the subcommittee, we had a pretty good model that was laid out until that point, that pivotal point, if you will, last session. The question for me is whether or not we place that liability on state employees for this, and I think that we may regret doing that. I think that while I agree with some of the provisions in here, I simply can't vote for the bill as it's written, and I do not think that this bill would have a pretty tough time sledding in the House as well. So I think we can save a lot of staff time and resources by putting this to bed right here.
Further discussion, Senator Wittich.
Mr. Chairman, members of the committee, I wasn't very happy with Senate Bill 423, but it seemed like we needed to do something. And I wish that those House bills could have moved along to address what the judge decided on his injunction, because I think that would have softened some of the harder edges of the current program to allow the will of the voters who said they wanted some amount of medical marijuana in Montana to occur in a reasonable way. But this bill takes us back to 2011 and even makes it, even makes our medical marijuana program bigger, which then counteracts the decision of the voters this year, or 2012, when they in effect ratified Senate Bill 423. So I'd like to find a balance where the people are and their views on this are respected. I just don't think 377 is it. So I'm going to be voting no.
Senator Larsen.
Thank you, Mr. Chairman. As Senator Vincent pointed out, I was on the subcommittee last cycle too, and I never dreamed in my wildest dreams that I would know this much about cannabis. But I remember that one of the driving issues that we had, and I think Senator Vincent would share this, is there are people out there that find relief from this stuff, and it works for them. And we had testimony from people from Libby and Darby and Jordan and Plentywood and all the larger cities about it. And I'm not a strong supporter of things like this. I worry about people in the supremacy clause. I do believe the federal government does have supremacy, and we've seen actions by them that threaten people. But Washington just passed a law. Colorado just passed a law. I'm going to support this bill mostly because they've added PTSD, and I want those little old grandmothers and people like that that are using cannabis to have it, if possible. So I'm voting to support this.
Senator Fielder.
Thank you, Mr. Chairman. I would like to be able to support something that allows patients, legitimate patients, to be able to access this as medicine, to be able to have providers be able to sell it and market it like other drug companies are allowed to do. But I'm not going to support this bill today because I don't think it reaches the balance that the citizens are telling us that they want. And the fiscal note is very concerning to me as well, and the layer of government that comes with this bill is more what I'm opposed to than anything else. And I agree that this expands the program beyond what it was before it was revised. And it's just, I commend the sponsor for bringing it. I know a lot of hard work went into it. The amendments are pretty good, but I still don't think it's quite what the citizens are telling us we need to do.
Well, since my signature's on it, I'm going to talk a little bit about it. And I am going to vote for it. I thought we made a big mistake with what we did 2 years ago. I thought that really all we needed to do was amend the initiative to tighten up the requirements on getting the card, and then amend labor law to allow employers to make drug tests mandatory and random, and that anybody that was found to fail a test for THC would not have, if they were fired for that, they would not have recourse to a wrongful discharge lawsuit. That's what I was for last session. I still think that's the way to deal with it. But I think this bill is worth going with, because I know some of those sick people, and I know they get relief that they can't get from any kind of medicine that's available in a drugstore. And they are not drug abusers. They're senior citizens mostly that never did an illegal drug in their life. And it works really well for them in certain cases. So with that, I will vote for it. Any further discussion? If not, call the roll, please.
This is for Senate Bill 377 to do pass as amended. Vice Chair Sales.
No.
Senator Brennan by proxy.
No.
Senator Fielder.
No.
Senator Vincent. Senator Boulanger.
No.
Senator Wittich. No. Senator Augare by proxy.
Yes, by proxy.
Senator Blewett.
Yes.
Senator Driscoll.
Yes.
Senator Jent.
No.
Senator Larsen.
Yes.
Chairman Murphy.
Yes.
Motion fails 5-7.
Okay, Senate Bill 377 will not proceed.
Mr. Chairman, I move that we...
Is there objection to reversing the vote to table? All in favor say aye.
Aye.
Opposed, no. Okay, that will be done. Let's see here.